So why these patients turn up? Like what kind of liver disorders?
They come with all kinds of liver diseases. The most common liver disorder is fatty liver.
So this is all due to fatty liver?
All due to cirrhosis, which can be due to fatty liver, it can be due to alcohol.
But this was not the scenario earlier.
This was not the scenario earlier, so we hardly had women coming with alcoholic cirrhosis of the liver.
When a patient or any woman who comes to you with liver issue, how exactly do you counsel them?
The commonest symptom that most women come with is they don't even recognize they have liver issues. Sweet girls or boys who come and say, "Ma'am, I don't know why I've been feeling tired," especially women. Do you have any of these symptoms? Like, do you have any jaundice in the past? Do you have any pain in the right side of the abdomen?
One healthy habit every woman should start today.
Stop alcohol if you're drinking alcohol.
लेडीज, क्या आपने कभी सोचा है कि कांस्टेंट फटीग, ब्लोटिंग एंड दोज एक्स्ट्रा इंचेस अराउंड योर वेस्ट, इसका रीजन सिर्फ स्ट्रेस नहीं बल्कि कुछ और भी हो सकता है, विच इज नॉन अल्कोहलिक फैटी लिवर, NAFLD। ये कंडीशन पहले सिर्फ ज़्यादातर मेन में देखी जाती थी, लेकिन अब ये वुमेन में एक नेक्स्ट बिग हेल्थ इशू बन गया है। और आज बियॉन्ड द पिल में हम इसी टॉपिक के बारे में डिस्कस करेंगे विद डॉक्टर आशा शुभलक्ष्मी मुसनूरी, हु इज अ लीडिंग गैस्ट्रोएंटरोलॉजिस्ट एंड हेपेटोलॉजिस्ट प्रैक्टिसिंग इन हैदराबाद। और आगे बढ़ने से पहले हमारे चैनल को सब्सक्राइब कीजिए एंड फॉलो अस ऑन इंस्टाग्राम, इट्स वन लाइफ बाय मैनकाइंड स्पेशलिटीज, क्योंकि ये कैंपेन के थ्रू हम हमारे व्यूअर्स को एम्पावर कर रहे हैं ताकि वो राइट इन्फॉर्मेशन से राइट हेल्थ चॉइसेस कर पाए। तो चलिए शुरू करते हैं। So welcome to our show, which is Beyond the Pill, ma'am. I mean, I would just like to tell you that we have started this campaign and this program so that through important doctors like you, who've been serving so much to the mankind itself, would help us circulate proper and right information. So, first of all, thanks a lot for taking out time and coming on our show.
Thank you, Chetna, and thank you, mankind, for this very nice honor.
So, when we talk about the hospital practice part of it, like you just mentioned that you see many patients who come from Africa, like why so?
Right.
So why are the patients from there visiting your hospital?
They've actually been visiting most of the hospitals I worked in the past also.
Okay.
And Africans find Hyderabad a very compatible place to work in and to stay in short term.
Okay.
The language and the customs and the friendly South Indians is what
True, but that
drives
is true.
them here. But it's the medical tourism because
Right.
Hyderabad is
Yes.
in Telangana is the medical hub.
Yes.
Is one of the medical
Yes,
hubs in
that's
India.
undeniable.
Yeah. And it's very well connected by
Yes.
flights now. Basically, the cost also. Earlier, they would go to Europe or maybe Egypt, and they find that the costs in India very reasonable, and the quality of medical
Yes,
services by
that
the
is-
doctors
Yes,
is par
far
excellence.
better. Yes,
They
yes.
feel that Indian doctors are very sincere and honest,
They
and they are the best in the
They
world,
are.
and they are the most skilled.
Undoubtedly,
Yeah.
yes, they are.
So that's why, and they've been following me for the past 15
We
years.
have a live example sitting in front of us.
Thank you. So they've been following me wherever I worked since the past 15 years, and we picked up some part of their languages too. Maybe a working concept that we have, me and my team, of Somali and a bit of Sudani Arabic, a bit of French,
Okay.
a smattering of.
So you talk to them in this language?
Yes.
No doubt, they're so comfortable coming to your hospital.
Thank you.
So why these patients turn up? Like what kind of liver disorders do they come to?
They come with all kinds of gastroenterology and liver diseases. The most common liver disorder is fatty liver.
Okay.
And most of them red meat eaters, and
Right.
they are not very aware of the disadvantages of eating too many calories and also not having high fiber in the diet,
Right.
having too much of bad saturated fats in the diet. Come with also diseases like advanced cirrhosis of the liver secondary to MASLD, that is metabolic
Yes.
associated steatotic liver disease.
Which is like a new term for...
It's a new term actually.
Yeah.
It's a 2023
Yeah.
EASL term.
Yeah.
Coined by the European Association for the Study of the Liver, and then the whole world picked it up.
Yeah.
So it's not called MAFLD now.
Yeah.
It's MASLD or
Correct.
metabolic associated liver
Yes.
disease. They come with various liver diseases like fatty liver induced or MASLD induced chronic hepatitis and cirrhosis of the liver, and the complications like blood vomitings due to varices, due to enlarged veins in the food pipe or the stomach, or liver cancers or altered sensorium. They become comatose and they're brought by air ambulances sometimes
Oh, that's
because of
bad.
the encephalopathy or the liver disease induced
Okay.
toxins in the blood which cross the brain. They cross the blood-brain barrier like ammonia.
So this is
and
all due to fatty liver?
all due to cirrhosis, which can
Cirrhosis.
be due to fatty
Fatty
liver,
liver.
it can be due to
Okay.
alcohol, it can be due to hepatitis B and C,
Okay.
it can be due to certain genetic diseases like copper metabolism defects like Wilson's disease, many causes of liver disease.
We don't take liver as seriously as we take heart, and
Yes.
actually that's not right, you know.
Actually, the liver is the most important
Yes.
organ because it's the best scavenger on the body.
Yes.
If the liver doesn't work, all the
Mhm.
toxins accumulate and
Correct.
they cause, if the liver doesn't work, the kidneys also fail, then the
True.
heart also gives
True.
up. The liver is the most important organ in the body, if you ask me.
So when you see this African patients or even the Indian patients, what do you think the prevalence has gone up in women as compared to men? Is it that way or?
Yeah, the prevalence of fatty liver has gone up in women also, but the cause of the fatty liver in Indians is slightly different from Africans.
Okay.
In Africans, it's predominantly either metabolic associated fatty liver because of obesity, insulin resistance, type 2 diabetes, and a lot of cholesterol rich foods or thyroid issues and stuff like that, or certain medications. Whereas in India, with the modernization, more and more women are drinking, and so alcoholic liver disease is also contributing to fatty liver in a big way.
Correct.
In women.
But this was not the scenario earlier, you know.
This was not the scenario earlier. So we hardly had women coming with alcoholic cirrhosis of the liver. But of late, we're seeing a lot of them coming in. And most young girls don't realize that women have only 50% of the metabolizing capacity of alcohol compared to men. Because they lack alcohol dehydrogenase, which is an important enzyme in the stomach. Once that is deficient, a woman shouldn't, I'm not sounding gender biased, but women shouldn't be drinking. No one should drink. Actually, no amount of alcohol is safe. Woman asks me, can I drink as much as a man? I would certainly say no. And that is not because of a gender bias. It's because of
the body
metabolic
mechanism,
functioning of the body.
But I'll tell you, this is like a very important message, because we see nowadays we say there's women empowerment and we are as good as men. I understand, but then there are some physical restraints that have to be taken care of, because women go through menopause, women have some fertility issues also which develops because of certain imbalances happening in our body.
That's a good question you raised, Chetna. Actually, before menopause, PCOS contributes a lot to the metabolic syndrome, which causes MASLD or fatty liver, because of the insulin resistance and the increased insulin in the body, which doesn't work to reduce the sugars in the body, blood also, and this causes increased trafficking of refined sugars into the liver. Then it comes to a point where the liver cannot handle so much sugar and converts the sugar into fat. So that happens with refined carbohydrates, maida-based foods, too much of very refined breads or refined noodles and whatever. And so you have to include a lot of high fiber cereals like oats or whole grains, brown rice, or multigrain bread if you're eating. Preferably sourdough bread, because fermented foods are also good for the liver and they help in improving the gut dysbiosis, which again is a big topic which causes fatty liver. You know, sadly, in our country, even if we talk about women's health, still women's health is not being taken as important as compared to men. My mother at home would take care of kids like me. She'll take care of my brother, she'll take care of father, but then she'll not take care of herself. She'll not give all the dietary requirement that she at her this age needs it. Actually, that's a very important message. A woman is the center of the family. And she should keep herself nourished so that she is healthy and safe for her family when they need it. For instance, if my daughter says, "Ma, don't go for a swim today. I want to watch a movie with you." I tell her, "Sorry, Ma. You come with a swim to me. You come with a swim. You come for the swim with me, or we'll watch a movie another day. But don't ask me to compromise on my swim because this is keeping me fit. Don't ask me to compromise on my walk. Because this 45 minutes, I'm trying to improve my metabolism and I'm also trying to calm down, do some meditation, reflect on the day, where I can improve, where I can do things better and reduce my stress levels, which again makes the whole family happier. I think the message to the modern woman is it's nice to emulate your mothers in many ways in terms of the affection you have for the family, but make sure you get some time for yourself. Some me time is important, some downtime where you are with yourself. You make sure you get your exercise, you eat the right food so that you're healthier and happier for the family.
Yeah, I mean, through you, I think that is why today we are here sitting with you, and you are like an example. You have your hospital duties, you have such a hectic and procedure, still you're able to.
Actually, even for this talk, it's not like I came unprepared. I got up in the morning and studied and came, though
Wow,
this is what we do
that's
day in
so
and day
good,
out.
Chhatrito. Good
My
to know.
student was asking me, ma'am, why do you need to study? You've been teaching us every day. I said, no, there may be some point that I might be missing, which would help in the discussion.
I feel good that you gave us the importance of
Thank
studying
you.
about
Yeah.
it. When a patient or any woman who comes to you with liver issue, so how, like as you told me that you give time to a patient, like
Yeah.
15 minutes, you sit down with the patient.
True.
So how exactly do you counsel them?
First, of course, they tell me the commonest symptom that most women come with is they don't even recognize they have liver issues. Is they say, Doctor, I've been feeling very tired of late. I'm working late, maybe. I'm partying hard. It depends on the person who comes in. Some of the software, because we practice in the software belt of Hyderabad. So many of them are young techies who come in, very sweet girls or boys who come and say, ma'am, I don't know why I've been feeling tired, especially women. I don't know why I've been feeling tired lately. I feel that my legs are swelling up. I'm not able to climb stairs the way I used to in the past. I'm not able to work out. I don't know what's happening. Then we calm them down and say, let me see what's wrong. Do you have any of these symptoms? Like, have you had jaundice in the past? Do you have any pain in the right side of the abdomen? Then they say, yeah, ma'am, sometimes we feel heavy in the right side. That's because of the enlargement of the liver and fatty liver. And then we ask them if they have any bony pains or joint pains, because some of them may be related to liver diseases like autoimmune liver disease or vitamin D deficiency, which can occur even in liver disease. And then once we ask them about any loss of appetite, any weight gain, weight loss, any thyroid issues, any PCOS if they're premenopausal, if they're menstruating, and have they noticed any increased hair on any part of the body of late? Then have they lost any muscle? Have they found easy bruisability of the skin? Like if they touch their skin, does it get friable? Does it bleed without any reason? Or if there's a cut, does it continue to bleed when it should stop? So these are some things. We also ask if they've been screened for hepatitis B and C, whether they're vaccinated for hepatitis B, and if they pregnant women, we ask them if their doctors are checking for gestational diabetes or any pregnancy-induced hypertension. We ask for history of miscarriages, any abortions in the past, stuff like that, and then we proceed to examine the patient. Once we examine the patient, we look for jaundice, we look at the eyes, we look at the skin, any pigmentation, look for swelling of the feet or pedal edema. Then we examine the abdomen, which is a very important part of medical gastroenterology and liver diseases. I always tell my students never to miss a physical examination and always see a patient from top to toe.
When we talk about hepatitis vaccination, I mean, even that's like a very important point to raise here, because vaccinations are something which, if not, a cure, but have some preventive percentage for the disease, So even when we talk about hepatitis, it's not, the awareness is really not very great amongst the population.
That's a very good question, Chetna. Hepatitis B is rising in India also. We have a prevalence of about 3%. So in Telangana, it's about 3 to 4%. That is 3 to 4%. 3 to 4 people out of any 100 people you meet will invariably be hepatitis B positive or C positive. Now, how does hepatitis B and C spread? It happens in very harmless, you think harmless situations, like when you go to a beauty parlor. The person may be using common pedicure or manicure instruments or threads. Or if one goes to a tattoo parlor, tattoo artists may be changing their instruments, but sometimes the tattoo artists themselves have to get screened. So I'm not saying tattoos are bad, but just be aware.
The hygiene part
Should be implemented. Then of course other spreads are from mother to baby during birth. If a mother is hepatitis B positive and is not aware, she might give birth to a baby who gets infected during delivery. It doesn't spread across the the uterus or the placenta to the baby. But when there is a mixture of secretions of mother and baby's blood during delivery, that is when hepatitis B is spread.
So, for this matter, it's important that vaccinations, people
Excellent.
start taking
That's a good
vaccines.
observation. Excellent observation. Yes, excellent point. We should encourage all people, the community. That's how I do a lot of hepatitis B and C camps for the community also, even international translators, because they've been coming to me for a long time, and they also need to be safe. So I have vaccinated, I've screened and vaccinated many people from all over the world, and the camps are important because they identify those people who need to be vaccinated. Who need to be vaccinated? Those who are hepatitis B and C negative, who are younger than at least 60 years. All of them, because once infected, hepatitis B can lead to first starts as fatty liver, then chronic liver disease, cirrhosis of the liver, and about 8% of them can get cancers. So all this can be prevented by a single dose. I'm not saying single dose, but a single set of vaccines. That is hepatitis B, because hepatitis B is also called a co-carcinogen. It is one of the leading causes of cancer worldwide. And these cancers, hepatitis B related liver cancers, are on the rise in India. So just by a simple vaccination, which is 0, that is the day 1 when you take it, and a month later, 6 months later, and a year later. So these are the 4 vaccines to be taken. If one is in contact with a hepatitis B positive patient in the family, then they go for the accelerated schedule, where the frequency of vaccines is less. So they take it 0, 1 month, 3 months, and a year. And if a patient is going for a transplant, like liver transplant or a kidney transplant, we make sure the patient is vaccinated before the transplant, well before the transplant.
I think it's a lot that you're giving in for the community, ma'am. I mean,
thank you.
It's quite inspiring as well. So, ma'am, if a patient, like especially women who come to you with fatty liver, what age group do they fall in? Is it that do you see patients who are more before the menopause or during puberty, or is it after, or you see this issue of fatty liver in women who have their menopause going on?
Very good question, Chetna, again. These days we are seeing people of all ages. Even young children, less than 5 years or 10 years, are coming in with fatty liver because of the junk foods. The screens, somehow they seem to increase the stress levels in children. The more phones they watch or the screens they watch. And the lack of exercise. They would prefer watching a cartoon show on TV or on their screens than go out and play a game.
Correct.
So parents should encourage their children to play physical games, because this not only improves their physical health, but also their mental health and also their school performance. Then coming back to your question, we see people of all ages, and youngsters who are menstruating women usually come in either because they're extremely obese, or they have diabetes, or PCOS. PCOS is a very common cause of fatty liver, and some of them are referred by gynecologists because they want to be checked up for fatty liver in view of the fact that they have PCOS. So the awareness is also being raised in the community as such. Many women come on their own saying, "Doctor, we have PCOS. We'd like to know the status of our liver."
So that means that hormone have a big role to play.
Yes, excellent. Yeah. Insulin resistance, which is the cornerstone of the fatty liver in PCOS, also occurs because there's an increased androgenic stimulation. So the increased androgenic stimulation and less of estrogens plus too much of insulin all increase the trafficking of fat and refined sugars into the liver, and it completely overwhelms the capacity of the liver to metabolize all that. So they get stored in the liver. They might seem harmless initially, and then they start destroying the liver cells, getting into the cycle of inflammation, and then irreversible liver disease because of fibrosis, cirrhosis, and then we know the rest of the story.
There's almost like this so much of hormone problem, and along with that, women are now having alcohol.
Yeah, so for PCOS, they should exercise at least 150 minutes a week.
That's the magic number.
Yeah. 150 minutes or 30 minutes a day, 5 days a week. Restrict or avoid alcohol. Reduce stress. Sleep better, because sleep also has an effect on the liver. And you need to sleep well to allow your liver to work. So at least 7 hours of beauty sleep a day. Some exercise, and even if you can't exercise every day, try small increments of exercise, small steps like keep your body moving would
Right,
be my
right.
message. In fact, we wrote a liver song, me and my daughter, which is there on my YouTube channel, which finally says keep your body moving.
Yes, correct.
And maybe if you can't exercise every day, at least after a meal, get around, walk, do some
yeah.
chores in the house which
Correct.
require physical
Right,
activity,
right.
or at least walk for about
Right,
10 minutes.
right. That's important, you
Yeah.
know. And when you talk about sleep, there are women who says, I don't get sleep. That's why I'm taking alcohol, so that I get a proper sleep. I said, wow, what
No,
a correlation. How you're
alcohol,
justifying taking
yeah,
alcohol.
that's just a justification. Alcohol might look as if it's lulling you into sleep, but ultimately it reduces the good sleep, that is the NREM sleep, and disrupts the sleep pattern. So alcohol is a big no-no in every way for the liver.
So it's just, you know, that fatty liver is not like a very big issue. All you have to do is like proper lifestyle, dietary
and
modifications.
the Mediterranean diet. You see a lot of people in the Mediterranean region, they might look fat, but they don't have abdominal fat. So the central obesity is
Correct.
one of the reasons
Correct.
for fatty liver, especially in Indians. Exercising, one tends to lose all the weight around the abdomen because that is the most dangerous weight. The excess adiposity around the abdomen, the
Yes.
fat, is a visceral fat, which again starts the cycle of inflammation, and then it goes across the gut into the liver and stimulates the whole cycle of fatty liver, fibrosis, cirrhosis, and cancers.
Major population of women I have seen having the abdominal fat.
Yeah, especially they say after cesarean, doctor, I was
That
advised
is
to take rest.
That is like the
So
thing they
that is
have.
when
Yeah.
that is when you see so many film stars who are actually
Yeah.
role models,
Yeah.
because they absolutely get rid of their
Correct.
abdominal fat
Correct.
within 3 or 4
Correct.
months after
Yes.
delivery.
Yes.
So those should be the role models we look
Correct.
at and model our life accordingly.
Yes.
Abdominal fat is a big no-no.
True.
Have fat around your hands,
Right.
have fat on your legs, that's fine.
Yes.
But around the abdomen, try to get rid of it even after delivery. Don't say I had a hysterectomy, so I was asked to rest by the
Yes,
doctor.
that is what
That's how the weight came, and stuff like that.
That is the only bahana they have.
Yeah.
You know, I have kids. I will have stomach. I said, no, that is not really what you should say.
Right. And then you asked about postmenopausal women.
Yes.
Postmenopausal women have, again, fatty liver, which is almost much higher than men. Premenopausal, because the estrogens, the hormones protect the women,
correct.
they are not on par with men. Like about 15 to 20% of women premenopausal or who are actively menstruating may have fatty liver, whereas men have the prevalence in men is about 30%.
Okay.
Once the menopause sets in, because of the visceral fat increase, abdominal central obesity, and the estrogen coming down, androgens may go up, the male hormones may go up, so their incidence of fatty liver is higher than men, and they get more of cirrhosis and liver cancers. Added to that, if they drink alcohol even a little bit, that's called MET ALD. It's another new term, that is metabolic liver disease plus alcoholic liver disease, a dual entity.
That's dangerous.
That's even more dangerous. The question comes, how much of alcohol is good? There is no, WHO says, and all our associations say, there is no good alcohol. There is no safe limit, but it gets toxic when a woman has more than 7 drinks a week or a man has more than 14 drinks a week. Now, what is a drink? A standard drink is about 10 grams of alcohol, and that is 10 grams can be a glass of wine, 100 ml wine, or 30 ml of any hard liquor like rum or whiskey, about 300 ml of beer. That
too, like it should be combined with physical activity.
Physical activity, and I wouldn't advocate drinking to anybody, drinking alcohol, but make sure you're eating a proper meal when you're, or eating along when you're drinking alcohol. No gastroenterologist will endorse alcohol or liver disease specialist will endorse. No one will endorse it. But in certain circumstances, when patients ask us, please make sure you're eating something and restrict your alcohol to the bare minimum.
See, it's not that we see a population where these conditions are coming up because people are not taking alcohol. They are going to take it. It is going to be there. I mean, they're not going to give up on that. But all we can do is give them a solution. If you're doing this, you along with this at least do this.
True.
Correct.
Yeah.
So that is how we can work it out. Otherwise, the people will stop going to the doctor because he won't get any results for that matter. So that's how all the doctors are trying,
Yeah.
everyone comes up with like lifestyle modification, because that is what is important.
And one more thing is coffee. Coffee is supposed to reduce fatty liver in about 30% of cases, especially black and green coffee. In moderation, 2 or 3 cups a day is being advocated. And there are studies proving that coffee is beneficial to fatty liver.
So nowadays having black coffee is also quite trending.
It is actually a good trend.
Yes.
Provided now the other thing is I see is the opposite. It may work for fatty liver, but it's also increasing the risk of gastroesophageal reflux and acid issues. So we tell them to temper it down.
Yeah, so we just like you mentioned that you also had your quiz, and let me get you back to that time.
Okay.
I have few questions and we can maybe take it as a quiz.
Yeah.
So there are few myths that we see that keep circulating even in the media nowadays. So we thought that let's just get it busted by an expert.
Okay, I'm getting scared now.
No.
I feel like I'm facing an exam.
No, I mean, this is your therapy.
Okay.
So tell me, is it true or false? Only overweight women get fatty liver.
False. Reason being, there's an entity called lean NASH or MASLD, where thin women, especially Asians, can also get fatty liver.
One everyday food that silently harms the liver.
Sugar. Sugar and sugary drinks.
Sugar is harming everything. So coffee, friend or enemy for your liver?
Friend, definitely.
Black coffee.
Black, green.
Then PCOS or menopause, which affects the liver more?
I would say both. It's unfair to say one affects more than the other, but menopause is even worse because there is lack of estrogen and the androgenic drive increases and the whole visceral fat is redistributed and most of it is shunted to the liver.
That can save a woman is a good diet.
Diet and exercise and stress-free life.
That is difficult to attain, I feel. Then if you had to name one superfood for liver health, what it would be?
We have to take a cue from the Mediterranean, so I would say olive oil or olives.
Olive should be included.
Yes, olives, fresh fruit.
The most underrated cause of fatty liver in women?
Thyroid issues.
Then one sign women often ignore that points to liver issues.
Again, feeling tired all the time, easy fatigability and sometimes swelling of the feet, hair loss, fall in concentration levels, reduced sleep.
So all the symptoms might look very, they're not very noticeable, but then
the most important is fatigue.
It's important to go and visit a doctor.
Visit a doctor, especially a liver doctor.
Then morning walk or yoga, what's better for liver health?
Both are equally good. Morning walk is aerobic.
Okay.
And yoga is also aerobic along with stress release. So both are equally good. Combination of both.
So it's just that you do something.
Yes, keep your body moving.
One healthy habit every woman should start today.
Stop alcohol if you're drinking alcohol and sleep well. At least 7 hours a day.
One simple daily habit women should adopt for a healthy liver.
Keep your body moving.
That's the only mantra.
Yes.
Thank you for listening to Beyond the Pill, where health meets conversation. So don't forget to subscribe to our channel and please share this episode with any one of your friend or family member for whom this episode can be useful. So अब मिलते हैं next episode में. Until then, stay informed, stay healthy. Love your liver.